Have you heard about the new COVID-19 variant called XEC that has recently been detected in the United States? It's natural to wonder how this new development might affect older adults like yourself or your loved ones. What does it mean for the safety and health of seniors, and how does vaccination fit into this picture? These are important questions that many older Americans are asking as the pandemic continues to evolve. Living through a global health crisis is never easy, and for older adults, the concerns can feel even more pressing. You may have heard different opinions about the COVID-19 vaccines, some encouraging, others raising doubts or questions. In a world full of changing information, knowing what to consider can feel overwhelming. This article aims to provide clear, respectful, and up-to-date information about COVID-19 vaccination for older adults in the United States, helping you understand the facts and make decisions with confidence and peace of mind. We will explore why older adults are considered a higher risk group for COVID-19, how vaccines work to protect the body, the specific considerations seniors might keep in mind, and the current guidance from health authorities like the CDC. Throughout this discussion, the goal is not to tell you what to do, but to equip you with knowledge so you can make the best choice for your health in consultation with your healthcare providers. The situation of the new COVID-19 variant and its rapid spread. Recently, health experts have observed the emergence and rapid spread of a new COVID-19 variant in many parts of the world, including the United States. Notably, the increase in cases has been linked to immigrants from countries such as India and China. This has raised many questions and concerns within the community, especially among older adults who are among the most vulnerable groups. This new variant of the SARS-CoV-2 virus may have characteristics such as increased transmissibility or the ability to partially evade immunity gained from previous vaccinations or infections. However, scientists and health professionals are actively studying this variant to better understand its severity and the effectiveness of current prevention measures against it. Knowing the sources and patterns of transmission helps health authorities implement appropriate monitoring and control strategies. These efforts aim to reduce community spread and protect everyone's health, particularly those at higher risk like older adults. We understand that information about new variants and the evolving pandemic situation can cause worry or confusion. It is important to stay informed through reliable sources, such as the Centers for Disease Control and Prevention (CDC), and to consult healthcare professionals for personalized advice. At the same time, maintaining basic preventive measures such as frequent hand washing, wearing masks in public, and avoiding large gatherings remains essential during this time. Why are older adults at higher risk from COVID-19? One important question that many older adults and their families often ask is, why are seniors more likely to experience serious illness from COVID-19? Understanding this can help you see the bigger picture and assess the risks in a balanced way. Research and health reports show that the immune system naturally weakens as we age. This means that as people get older, their body's ability to recognize and fight off infections, like the virus that causes COVID-19, may not be as strong as in younger individuals. Simply put, when an older adult is exposed to the SARS-CoV-2 virus, their immune system might respond less effectively to stop and eliminate the virus. In addition, many older adults live with chronic health conditions such as diabetes, heart disease, high blood pressure, chronic lung diseases, or kidney problems. These underlying health issues can increase the chances of severe complications and serious outcomes if COVID-19 infection occurs. As a result, the rates of hospitalization, need for intensive care, and unfortunately, death are higher among seniors compared to younger people. Moreover, recovery can take longer for older adults, which may affect their overall health and quality of life. This is why having a clear understanding of the risks is essential when considering protective measures, including COVID-19 vaccination. How COVID-19 vaccines work. You may have heard a lot about COVID-19 vaccines, but have you ever wondered exactly how they protect your body against the virus? Understanding this can help you appreciate the important role vaccines play in preventing illness. COVID-19 vaccines are designed to help your immune system recognize the SARS-CoV-2 virus without causing the disease itself. When you receive the vaccine, your body learns to identify a part or a signature of the virus, such as the spike protein, and produces antibodies and special immune cells that can fight the virus if you are exposed in the future. It is important to know that vaccines do not contain the live virus that causes COVID-19, so getting vaccinated cannot give you the disease. Instead, vaccines train your immune system to respond quickly and effectively if it encounters the real virus in the environment. In older adults, because the immune system is not as strong as it used to be, the response to the vaccine might not be as rapid or intense as in younger people. However, studies show that even if the immune response is somewhat reduced, vaccines still provide significant protection by lowering the chances of severe illness, hospitalization, and death. Additionally, over time, the protection from the vaccine may lessen, especially as the virus changes and new variants like XEC emerge. That is why booster doses are often recommended to strengthen and prolong your body's protection, particularly for older adults. Important considerations for older adults receiving the COVID-19 vaccine. When thinking about getting the COVID-19 vaccine, it's natural for older adults to have questions and concerns. Understanding some key points can help you feel more comfortable with the vaccination process. First, you might experience some mild side effects after vaccination, such as soreness or swelling at the injection site, fatigue, mild fever, or headaches. These reactions are normal and indicate that your immune system is working to build protection. Typically, these symptoms last only a few days and rarely cause serious problems. For older adults with underlying health conditions like heart disease, diabetes, or weakened immune systems, consulting a healthcare provider before vaccination is important. Your doctor can evaluate your individual health status and offer guidance on the safest vaccine type and timing for you. Additionally, receiving booster doses is often recommended because vaccine protection can decrease over time, especially with new variants emerging. Booster shots help maintain immunity levels and reduce the risk of severe illness if you are exposed to the virus. Finally, while vaccines can lower the chance of contracting COVID-19 and experiencing serious complications, continuing other preventive measures such as wearing masks, practicing physical distancing, and frequent hand washing remains important, especially while the pandemic is still ongoing. Current public health recommendations for older adults in the United States. At present, leading health agencies in the United States, such as the Centers for Disease Control and Prevention (CDC), continuously update and provide detailed guidance for older adults regarding COVID-19 vaccination. These recommendations are based on the latest research and data about vaccine safety and effectiveness, while also taking into account the ongoing emergence of new virus variants like the XEC variant. The CDC emphasizes that receiving COVID-19 vaccines, including both primary series and booster doses, is an important part of protecting the health of older adults. The goal is to reduce the risk of severe illness, hospitalization, and death related to COVID-19. However, the guidelines are flexible and are adjusted based on individual circumstances, such as personal health conditions, age, and other risk factors. In addition to vaccination, the CDC and other health organizations recommend that older adults continue practicing other preventive measures. These include wearing masks in public or in places where the risk of infection is higher, maintaining physical distance from others, especially in crowded settings, and frequently washing hands. Furthermore, older adults are encouraged to regularly monitor their health and promptly report to healthcare providers if they experience any symptoms that may suggest COVID-19 infection or any unusual reactions following vaccination. Keeping in close contact with healthcare teams helps ensure timely and effective support. Vaccine access and availability for older adults in the United States. In the United States, ensuring COVID-19 vaccine access for older adults is a top priority in vaccination campaigns. The government and health organizations have implemented various measures to make vaccines widely available, easy to obtain, and convenient for this important group. Free vaccination sites are set up in many locations, such as hospitals, community health centers, pharmacies, and senior centers. Additionally, for those with mobility challenges or health limitations, home vaccination services are offered to help seniors avoid the difficulties of travel. The government also collaborates with social organizations, elderly care centers, and healthcare facilities to organize informational sessions, answer questions, and assist with vaccine registration. This helps older adults access full and accurate information about the vaccines. Making vaccination easy and free helps reduce financial, transportation, and informational barriers, creating conditions for more older adults to be protected against the risks of COVID-19. Conclusion and a message for older adults. COVID-19 remains a significant challenge to public health, especially for older adults, one of the most vulnerable groups. Understanding the role of vaccines, important considerations when getting vaccinated, and staying updated with health recommendations can help you have a well-rounded perspective and feel more confident in managing your health. Every health decision is important and should be made based on careful consultation with healthcare professionals. We hope the information shared here has helped you feel reassured and better equipped to discuss your concerns with your doctor or loved ones. What are your thoughts on COVID-19 vaccination for older adults? Please feel free to share your opinions or questions in the comments below. If you found this video/article helpful, don't forget to like and subscribe to the channel for more useful health information. Thank you for watching, and we wish you good health